Hi everyone and welcome to our presentation on Intro to Toilet Training. My name is Lauren and I'm an occupational therapist here at the Thrive Child Development Center. This presentation is designed as a recorded resource that can be watched at any time. The purpose of the presentation is to provide an overview of the toilet training process through a developmental and child-centered lens. Rather than focusing on quick fixes or rigid timelines, we'll talk about toilet learning as a gradual process that looks different for every child and every family. This presentation was developed collaboratively by occupational therapists and a speech-language pathologist. This presentation is meant to help reduce pressure, normalize challenges, and support caregivers in understanding what toilet training can look like across the different stages of the journey. Whether your child is not yet showing signs of readiness, you're preparing to start, or you're navigating ongoing accidents, this information is intended to meet you where you're at. Before we begin, let us take time to recognize the origins of the Robinson-Huron Treaty Territory and the people who came before us. This land on which we are gathered is the traditional territory of the Anishinaabe people and our Métis brothers and sisters. We hold in great respect the lands, the histories, the languages, the knowledge systems, and the culture of the First Nations and Métis people whom we work with, Miigwech. I'd also like to discuss some of the benefits and limitations to this presentation before we begin. This presentation provides accessible, evidence-based foundational knowledge for caregivers. It is rooted in our most up-to-date knowledge of neurodevelopmental and relational neuroscience and provides tangible strategies as a starting point. Some limitations include that it is not individualized to a family or child's needs. It may not meet the full support needs of some families and caregivers. Some may find this information overwhelming. All participants may take something different from this presentation, and virtual learning may not be the best learning method for some. We are always learning. We welcome and encourage respectful sharing of questions, perspective, and feedback as an occupational therapy department. Content in this presentation reflects cross-disciplinary perspectives and practices and represents what we have learned so far. Knowledge and best practice are continually evolving. Our practice is guided by clinical research, clinical experience, and through the lived experiences shared by children, youth, and families we serve. Content shared in this presentation is not intended to supersede or replace lived experience. We're committed to promoting the well-being of children, youth, and families in our community, particularly those who strive to be seen, heard, and included. This commitment includes partnering with other individuals and organizations in this shared mission. We hope that through the sharing of new learning, we can help to clear the path for children to grow into the most authentic versions of themselves, and for their adults to be empowered to guide them along the way. Today we'll start by talking about some common toilet training myths and truths, then we'll move into goals and expectations. We'll cover readiness for both the child and the entire family, how to prepare yourself, your child, and your home, and then we'll walk through the training phases step by step. We'll also touch on some toileting specifics like nighttime training and transitioning to the big toilet, and then we'll end with some final thoughts. First, we're going to discuss some myths and truths of toilet training. One of the most important takeaways from this presentation is that there is no one-size-fits-all approach to toilet training. Children vary widely in their development, sensory processing, communication, and regulation, and toileting needs to be flexible enough to match those differences. A common myth is that toilet training happens in just a few days. You may have seen it online, train your child in 3 days. The reality is that toilet learning isn't linear. Children might make progress, they might regress, and then they might move forward again. Accidents are a part of the learning process and they do not equal failure. Expecting quick results can increase stress for both the child and the caregiver. The second myth we'll discuss is that toilet training shouldn't be a big change for your family. It may often even be described as no big deal or just another part of development, but in reality, it's a huge life transition. It impacts family routines, it impacts the environment, expectations for the child, and oftentimes their regulation. How a child and your family typically cope with change and transitions can play a role in how this process unfolds, and it's important to consider that and reflect on that during and before the process. Myth number 3 is that toilet training always happens by a certain age. There's a lot of pressure around age-based expectations and milestones. The truth is that toilet training can happen at different ages and stages, and being toilet trained may look different for each child depending on their development and abilities. Myth number 4 is that a child needs to talk or verbally communicate to toilet train. The truth is that verbal communication is not a prerequisite for toilet training. Children who are non-speaking or minimally speaking can absolutely learn to use the toilet. Communication can happen through gestures, visuals, routines, and adult modeling, and we'll talk more about this later. Now we'll discuss some goals and expectations related to toilet training. As an occupational therapist, one of the most common questions I hear from families is, shouldn't my child be toilet trained by now? And often that pressure comes down to age. Chronological age is commonly used as a guideline because certain skills like bladder awareness, motor abilities, communication often emerge within similar age ranges. But the reality is that every child develops differently. For children with developmental differences or potentially a neurodivergent profile, toilet learning may follow a different timeline, and that's okay. What we're really looking for isn't age, but readiness. Readiness is influenced by factors like sensory processing, awareness of body signals, emotional regulation, communication in any form, and skills like motor planning. As a society, we place a lot of value on independence, especially with toileting. But when children are pushed before they're ready, it can lead to stress, power struggles, and frustration for both the child and the family. Throughout this presentation, I hope that we can shift the focus away from age and timelines and instead talk about how to support true developmental readiness in a way that reduces pressure and builds confidence for the entire family. So when you're reflecting on your own goals and expectations for toilet learning or toilet training, I encourage you to think about a few things. The first is to focus on readiness. Prioritize your child's readiness over that strict timeline or deadline for toilet training. I also want you to think about how if you need to support your child through the toilet learning process or while they're toileting, that does not equal failure. So let's say you see some progress in their understanding of using the toilet, but you're still supporting them quite heavily through that process. That doesn't mean that they're failing or that you're failing. Some kids may need ongoing help with toileting, and that's okay. It's also important to reflect on the fact that you know your child best. Families understand their child's needs better than anyone, and you should be the one guiding this process. I would hope that you can also redefine success. I would encourage you to reflect on what does success of toilet learning or toilet training look like in your mind. Success doesn't necessarily mean being fully toilet trained by a specific age. I think of it more as the child feeling safe, supported, and confident throughout the toilet learning process. I hope that you can break the process down into your own manageable goals that can be achieved over time. So similar to what I just mentioned, I hope that you can reflect on your child's current toileting routine, their skill level, and their overall engagement with that toilet learning process. Maybe you can think about the big goal of toilet training and then break that down into smaller, more achievable steps. This can help you feel overwhelmed with the expectations or, thinking just about that big goal of toilet training. Focus on one goal at first. Maybe that is helping the child recognize their own body signals or just becoming a bit more comfortable with the routine of toileting. And then maybe start there. The next topic we'll discuss is considerations for child and family toileting readiness. So first, we're going to talk about signs that your child might be ready for toilet training. One of the things that I usually recommend is for families to notice if their child is going for longer stretches without soiling their diaper. So that can be, voiding of their bladder or having a bowel movement. We're usually looking for about 1 to 2 hour periods where they're starting to hold. Something that I find helpful for families is they start to monitor when their child is going, because oftentimes when you go to change the diaper, you may not have known how long it's been there, especially if your child isn't necessarily coming to you to tell you that they've done that. Another thing I recommend looking for is that your child may start to act a bit differently when they notice that they have to go or have already gone. So some examples could be they notice when their diaper is wet or soiled, and maybe they indicate to you that they've gone. They may show a desire to remove their diaper themselves, or they may pull at it or dig into their diaper. They may use a different stance when in the process of soiling, and maybe that's even when they're about to go. Now, something to remember is that this can be very, very subtle. Our children's signs might not be obvious to the average eye, and so I usually encourage families to take some time to even just really pay attention to their child's subtle signs and then start to write some of those down to see if they can come up with a pattern of that, because that's going to help you during the toilet learning process. Another thing to consider, or that might tell you that your child is ready, is their interest in toileting or the toileting process. So maybe they watch others go to the toilet or really pay attention when the person's going to the bathroom. Maybe they follow you to the bathroom. It's your one time that you can be alone, but they want to follow you and watch you as you go. Maybe they show interest in flushing the toilet, turning on the taps, unrolling the toilet paper, etc. Some other considerations when reflecting on your child's toileting readiness is some medical factors. Now, I am not a physician, and so I cannot provide medical advice. However, it's important to reflect on the fact if your child has had a history of constipation or urinary tract infections or issues with voiding their bladder or bowel. This might lead to some challenges with toilet learning. And so if you do have a history of those things, it's important to consult your physician and discuss how that might impact toilet learning and if they have any suggestions to support that. It's also important to consider if your child has a history of regression in feeding, sleeping, or holding their bowel movements or voiding when there's new changes or stressors, because I've also seen that before as well, where when toileting is starting or we're trying toilet training, that the child may regress in other areas. And so, like I said, I'm not a physician and I cannot provide medical advice, but just considering those things and consulting your family doctor or a physician is something that we do recommend in this process. Additionally, it's important to consider your child's level of engagement with you and with their environment. If a child is having a hard time paying attention to their environment or the people in it, then this process might be difficult. And so maybe we need to focus more on increasing that level of engagement prior to expecting toilet learning. It's important to note that some of our kids may seem disengaged with us or disengaged with their environment when they're actually paying very close attention to their environment and what people are doing around them. So as I discussed earlier, verbal communication is not a prerequisite for toilet training. So for children who may have difficulty understanding spoken language or who may have difficulty telling you, oftentimes when they do learn to toilet train, they're understanding it through the routine that's created and through repeated practice and observation of others, because that's oftentimes how our children learn. If your child has difficulty understanding spoken language, it does not mean that you need to delay toilet training. It just means that you may need to use less language and use more showing. And we do have some handouts regarding this, and we'll talk about this a bit more later. So we've talked quite a bit about child readiness, but what about parent or caregiver readiness? Well, this matters just as much, believe it or not. This includes your mindset, your communication style, your time availability, and your support systems. If any of these things feel a bit shaky, it's okay to slow down or stay in the prep phase a bit longer, but we'll talk about each of these a bit more. So first we'll talk about mindset. We've talked a bit about this already, but it's a very important part when we consider if we're ready for toilet training and working with our child on their toilet learning journey. Toilet learning is about a process. It's not about the finish line. It's a gradual journey with ups and downs. When we try to control this process, we often end up creating power struggles. Instead, our goal should be to support our child's autonomy. We want to help our child feel capable and confident in this process. When children feel empowered, cooperation often follows. Messes and accidents are expected and they're an important part of learning. Be confident in your role as a parent. You are the expert of your own child. Try not to compare your child to others because everybody is on their own toileting journey and it may look different from child to family, from child to family. Progress does not need to follow a specific timeline. In thinking about your mindset in relation to the toilet learning journey, we wanted to provide you with some reflective questions so that you can better understand your own stress responses to better support and help your child throughout this process. These questions are meant for reflection, not for judgment, and so that is why we wanted to provide you with them. So the second point that we hope for you to reflect on is your own communication style. When supporting toileting learning, we recommend using a low demand style of communication. This means focusing more on commenting and describing what's happening rather than giving direct commands or instructions. But why would we do this? Well, this approach helps your child become more aware of their own body sensations and begin to connect those feelings with the actions they need to do, like use the toilet. This also helps promote child autonomy. It allows them space to process and respond in their own time, which overall helps reduce pressure and resistance.
So for example, instead of saying something like, go sit on the potty now, you might say, I see you're holding your tummy. Maybe you need to use the potty. This invites your child to tune into their body signals and then make a choice, rather than feeling forced. We'll go over some more specific communication strategies and examples in more detail during the potty prep and training sections of the presentation. But for now, remember that this low demand and low pressure communication style helps build understanding and confidence and allows you to be the guide rather than to force your child through this process. Another thing we hope for you to consider is time. Toilet training is a process that unfolds over several phases, and understanding the timeline can help set realistic expectations. The first phase is the prep phase. This is where you and your child start getting ready for toilet training, and this ideally begins about 1 month before you plan to start. During this time, you'll start to introduce concepts related to toileting, familiarize your child with the potty or toilet, and build awareness around some toileting routines. Then, about 1 week before the official start, it's helpful to increase your focus on getting your child ready and comfortable with the idea. So maybe you're talking about the process, you're starting to practice routines, and you're setting up the environment. Next comes the potty training phase itself, and this usually requires a commitment of 3 to 5 days is what we recommend, and it's focused uninterrupted time in one environment. During these days, your child might learn the foundational skills needed for toileting use, like recognizing their body signals, following routines, and practicing independence. It's important to remember that this timeline for being mostly accident-free after the initial phase is highly variable. Every child's different, and for some it might take weeks or even months to feel confident and consistent. Also keep in mind there might be a difference for toilet learning of urination versus bowel movements. Oftentimes, bowel training can take a bit longer and it might require some different supports. Being patient and responsive to your child's individual pace during these phases will set you both up for success. So the final point I want to discuss is your support system or support network. For the initial 3 to 5 days of that focused toilet training, we recommend having a designated lead caregiver. This person will guide the process, ensure consistency, and respond to your child's needs during this important period. Because we know toilet learning continues beyond those few days, it's important to also have a secondary person who can support and continue the process when you aren't available. Again, this teamwork helps create consistency, reinforces learning, and it provides your child with reliable support across different settings and caregivers. It's also really good to have this person to, give that call to if you're in the depths of toilet training and you're like, I can't do this anymore. That's super normal and probably expected, and so having that support for you is really important as well. If your child does attend daycare or school, it's important to think about, what's going to happen after those 3 to 5 days when they return. It's important to communicate with your daycare or school providers ahead of time to ensure that expectations and approaches are aligned as much as possible. Collaboration improves consistency and success with something like toilet learning. So now that we've talked about the foundations of toilet learning, your child's readiness, your readiness, goals and expectations, etc., we will start to talk about the toilet learning, and we begin that with the prep phase. The prep phase is super important. I do not want you to skip this part or undervalue this part. It is vital to your child's learning and success in the next phase. Like I mentioned earlier, prepping for toileting learning might look a bit different depending on your child's needs. It might involve a different timeline, or it might involve different approaches or things used to prepare your child, but overall it involves preparing yourself, your home, and your child, and we'll talk about each of those a bit more. So to begin, we'll first discuss prepping yourself. So this is slightly repetitive, but we want you to prep yourself by reflecting on your expectations of toilet learning. So what are your expectations for the timeline? Oftentimes, timeline in training is unknown and variable. It can last a couple days, it might last longer for other children, and there might be differences between a child's readiness for training of their bowel movements versus urination. We also want you to think about and reflect on timeline for prep. How long does your child typically need to prepare for something? How do they deal with change and transitions? This might inform how long you might stay in that prep phase. And what does success look like for you? Again, think back to the start of the presentation and reflect on what your overall goal, hope, and thoughts are around success related to toilet training. Again, we've talked about this a bit more, but it's important to prepare supports. Determine who your support people are. Is there someone who can provide direct support, like trading off? I need a break. I can't do this anymore. You got to sub in for me for a bit so I can go take a shower. Is there someone who can provide support maybe over a phone call if you are alone in your home with your child? Are there other environments the child accesses that, these people may need to be aware of what's going on with your toilet training, like daycare and school, which we've already mentioned. So part of prepping yourself is understanding how toilet learning and toilet training might impact your regulation and your child's. Toilet training is a big change. As we've discussed, it's a big life transition, and change can be really difficult for our kids as well as for ourselves. Naturally, toilet training is going to impact our regulation and our child's, but in order to understand the impact it might have on toilet learning and the success of toilet learning, we need to talk a bit more about this term regulation. It's a buzzword, we hear it frequently, but do we even know what it means? So regulation, and more specifically nervous system regulation, is the process by which the nervous system controls and balances our body functions, helping our body respond to changes that are going inside of it and outside of it. So this includes managing things like our heart rate, our breathing, and our emotions to keep our body stable and working properly to respond to things. So when our nervous system detects a threat, and a threat can look different to all of us. One thing may be scary for one person, and that thing might not be scary for another. So when our nervous system detects that threat, we enter protective modes. We often label these as fight, flight, freeze, or maybe you've heard of the term fawn. If we enter these protective states, our frontal lobe is less accessed, and that's our thinking brain, so it's much harder for us to learn in these states. If our kids feel threatened by toilet learning or toilet training, how can we better support them so that they can learn? And I'm going to tell you, the best way that we can support our kids with their regulation is by providing co-regulation. So the strategy is you. Co-regulation as the adult that is supporting them through the toilet learning process. I'm going to tell you that if there's a slide to pay attention to, it's this one. Co-regulation is the most important part of supporting our kids through the toilet learning process. It means the adult uses their own calm presence, tone, and body language to help the child feel safe and regulated. Children can't regulate on their own yet. It is not developmentally appropriate to expect that. And they rely on us as the adult to borrow our calm and safe nervous system so that they can stay in that learning mode. And if they feel stressed, this can help prevent them from entering that fight, flight, or fawn. Through co-regulation, we show children that they are safe, that we are here for them, and that we can do this together. When a child feels supported and not pressured, their brain stays open to learning new skills like toileting. Our presence becomes the strategy that helps them try, practice, and succeed. It's important to mention that when you're teaching toileting and toilet learning, there's going to be stress. We can expect that this will be a stressful experience. And the goal is not necessarily to take away that stress. The goal is for us and our child to remain regulated enough to handle that stress so that learning can take place. We want our children to ultimately make the connection of feeling like they need to go and then knowing that their urine and bowel movements go in the toilet. When we do a mental switch of moving from how do I get my child to pee on the potty to how can I focus on making my child feel safe throughout this process, we are less likely to then see those protective responses and more likely to see learning taking place. This is truly the foundation to this entire presentation and this approach. So we're still discussing how you can prepare yourself, which includes your understanding of factors that might impact toilet learning and the success of toilet learning. And one of those things is the concept of sensory processing. It's important for us to understand this concept very generally and its potential impacts on toileting for our children. How our brains process sensory information has a direct impact on our regulation, which we know impacts toilet learning. Toileting isn't just about knowing when to go. It's a complex task that involves multiple sensory systems working together. When a child struggles with toileting, it might be linked to how they interpret and respond to sensory information. Everyone has unique sensory preferences that affect how we feel and function, especially when it comes to toileting. So we'll briefly discuss the 8 different sensory systems. You might have only known about 5, but today we'll discuss 8 because there's actually 8, and how generally those might impact toileting. So the first is touch or tactile, and that includes how we feel textures, pressure, temperature, and pain. The second is auditory, or our ability to hear and process sounds. The third is visual or sight, which includes visual tracking, focusing, and interpreting what we see. The fourth is olfactory, or our sense of smell. The fifth is gustatory, or our sense of taste. The sixth is vestibular, which is the sense of balance and movement, which is controlled by the inner ear. The seventh is proprioception, which is our sense of where our body is in space. And this helps with coordination and understanding how much pressure and force goes into our joints and into our body. And the eighth is interoception, or our sense of internal body cues, sensing things like hunger, thirst, or the need to go to the bathroom. All of these things are going to have an impact on how we experience toileting. So why does sensory processing matter? Well, every child experiences their environment differently, especially when it comes to sensory input. Sensory preferences play a big role in helping our children regulate their bodies and emotions, which is key for successful toileting. Sensory overload, like loud flushing sounds, strong smells, or uncomfortable textures, may be overwhelming and might delay a child's ability or willingness to use the toilet. On the other hand, calming sensory strategies like soft touch or quiet spaces can help signal to the body and brain that it's time to engage in toileting. Understanding a child's unique sensory profile isn't necessary for toilet training, but it can help inform toileting routines that might feel a bit more comfortable or manageable. So for example, some children do best with soft, non-abrasive materials and distraction-free environments, while others might need gentle background noise or a more stimulating environment to feel at ease. Paying attention to your child's sensory preferences can help you create a supportive toileting experience that helps reduce stress and encourage success. Now we'll move on from talking about prepping yourself to prepping your home. So when preparing your home for toilet training, it's important to create a comfortable and supportive bathroom environment, especially for those kids with sensory differences. Bright lights, loud flushing, strong smells, maybe visual distractions might feel overwhelming for your child, so if we can reduce these, that might help. Think about the equipment you're using as well. Some children feel more secure on a small potty, while others might prefer the regular toilet with supports like a child step stool. Small, thoughtful adjustments based on your child's preferences can make toileting feel calmer and more manageable. Adaptive toileting equipment like potty chairs, child-sized toilet seats, step stools, or grab bars might help make a big difference in helping your child feel safe and comfortable during toilet training. Choosing the right equipment depends on your child's size, their motor skills, and needs. If you're unsure what might work best, or if your child has sensory or developmental differences, consulting an OT is a great step and may help. OTs can provide more personalized recommendations and supports to make toileting easier, but everything you see here is over-the-counter products, so you could purchase these and try to see if they help. Something like a toilet reducer ring or those step stools with the handles can really help a child feel more secure, especially on a big toilet. And if your child has some body awareness or motor differences, something like that simple might actually help a lot. So something else we suggest preparing is a potty basket. And a potty basket is a helpful tool to encourage your child to spend more time on the toilet. Just sitting there might be boring, right? Especially if your kid's a mover and a shaker. They don't want to just sit there. So your potty basket can include some of their favorite things like books, fidget toys, Lego blocks, anything that might help hold your child's attention or make them feel more comfortable. It's important to use these items to support your child lingering on the toilet, but to not use them as a reward or incentive to stay. So we do not recommend, saying like, if you stay here for 2 minutes, I'll give you your potty basket. It is there for them to use at their free will. Also, the items should stay with your child, so if they take them to and from the bathroom freely, that's totally fine. This just helps create more of that positive, low-pressure experience around toileting. So now that we've discussed preparing your home, we'll discuss preparing your child. So we've briefly talked about this term interoception, which we know is a sense or a part of our senses. Interoception is your child's internal body awareness. So it's like that internal dashboard that helps them notice what's happening inside their body. So this can include something like feeling a full bladder or sensing that pressure before a bowel movement, or realizing when it's too late to get to the toilet. Toilet training relies heavily on a child being able to notice and respond to their internal cues. So when interoception is maybe more inconsistent, a child may not notice that they need to go, they might realize it too late, or they might have difficulty explaining how their body feels. This can sometimes be misunderstood as something like laziness or a lack of motivation, but that's usually not what's happening. The child isn't ignoring the urge, they may simply not be receiving the signal clearly. So understanding this helps us approach toilet learning with more patience, and we can use strategies that support a child's unique sensory experience. And one of those big strategies is these prep statements. So before I mentioned that we have some handouts that might be helpful while you're on your toilet learning journey, and this is one of them. So these are prep statements that were developed to teach the child about the toileting process and routine, which in turn helps teach interoceptive cues. So maybe you're commenting yourself before you use the washroom. Oh, I feel something in my belly. I need to use the bathroom. And really making those cues and language very apparent in your house. You may even make comments about your child. So if you notice that they're going actively, you might mention that, that it feels a certain way for them. Oh, this feels different. You're peeing in the potty. So these are ways that we can help guide and teach our child, as well as help them kind of clue into their own bodily cues. This specific handout has a side that you see here, so example prep statements, but there's also another side to this handout where we provide statements or recommendations on how to use less language and more gestures or bodily movements to teach these things for our children who may struggle with communication. So the final point I want to discuss about preparing your child is the concept of utilizing resources to help support this process. So I want you to consider your child's interests or their special interests. Is there a character that they love? Is there a book that they love? Is there songs? Is there YouTube videos? Like, what does your child gravitate towards? And oftentimes we're lucky enough that a lot of these shows or YouTube channels, especially if they're kid based, they have episodes on toilet training. There's also lots of different types of songs related to toilet training. There's books, and you can see just a few there that I've linked on YouTube. That might be helpful to incorporate in preparing your child. So maybe you're playing that episode, in the living room as they play. Maybe you're using their dolls or their stuffies, their favorite figurines to demonstrate toilet training in play. Our kids do a significant amount of learning from play, and some of our kids also do a significant amount of learning from their favorite shows or special interests. So it's important to include this while you're preparing them for toilet learning. Okay, so we've made it to the training phase. So now we'll discuss the actual process we recommend for toilet training. So phase one of the toilet training phase is the toilet training foundations phase. And the focus of this phase is that we are actively and intentionally teaching our kid the skill of voiding their bowel or bladder into the toilet. So really we want to help make that connection that their bowel and bladder movements go in the potty and not into their diaper. This phase follows that prep phase, but if your child is not showing signs that they're ready to move into the training phase, then you can continue to stay in the prep phase and continue to use the strategies we discussed earlier. Some signs that they may not be ready to move forward would be things like they still are experiencing a lot of stress around the toilet. They have limited to no awareness of their bodily sensations, or they really have no curiosity or interest in being in the bathroom, going near the toilet, etc. So as I mentioned earlier, in phase one, we suggest selecting a date and time to focus on training. We recommend at least 3 days, but ideally closer to 5 days, to focus solely on toilet training. We suggest not having other commitments or plans during this time, and we also recommend that children go without pants or underwear to help them get to the potty on time. They don't have to worry about taking their pants off or, something getting in the way of them making it and having success. So for girls, that might look like wearing a dress, or maybe for boys, it's a long shirt, but regardless, whatever works for your family. It's extremely important to note that the goal of this phase is not to be accident-free. This is not realistic, and accidents are an important part of learning. The goal is to help your child start to make the connection between the feeling of needing to void their bowel or bladder and then using the toilet. We wouldn't expect that your child be completely toilet proficient by the end of this phase. This oftentimes takes months, and we can continue to expect accidents well after the training phase. So I'm talking about the training phase, but what is the training phase? What do you actually do to train? Well, we recommend some steps. And the first step is to be on the lookout. So from the moment your child wakes up, you're going to be on pee and poo watch duty. You will be watching them all day for signs that they need to go to the bathroom. Some children may have obvious signs, whereas others might be more subtle. And we talked about maybe what some of those subtle signs might look like earlier in the presentation. But some examples are wide eyes, or their eyes are watering, pausing and then starting to use the washroom, doing a little dance, holding their genitals, crossing their legs, etc., etc. It's important to have an awareness of what that sign is before going into this phase so that you can be on the lookout. During these initial stages of toilet training, it's your job to be identifying when your child has to use the washroom. So you'll be identifying cues for them needing to use the toilet and helping your child then get to the toilet. Over time, we hope that your child will start to link that sensation, and they will have a more active role as time progresses in initiating using the toilet. So we talked about step 1 being on the lookout. Step 2 is when your child needs to go. So when your child actually needs to go, what are you doing? Well, in this step, we are trying to get them to the potty. So you are going to allow your child to make the decision if and when they want to go, which can be really tricky, but that's what we recommend. So if they begin to have an accident, try and help them to the potty. So if you notice that your child needs to go, you might say something like, "You look like you need to pee or poo. The potty's right here," or "Let's try on the potty." If your child is actively going, you might say, "Oh, you're peeing on the floor. I'm going to help you to the potty." Now, again, we have some handouts about statements we recommend during this phase. And again, we have the less language version of this handout for children who may struggle with their communication. I might sound a bit like a broken record, but we really want to stress the importance of trying to avoid making your child try on the potty or stay on the potty, because what ends up happening here is usually a potty battle, which leads to stress, dysregulation, and maybe that fight, flight, freeze response with the frontal lobe shutting down and preventing our children from learning. So if you take anything away today, it's really try and avoid that forceful guidance to the potty and instead use some of the other strategies we've brought forward. But what if your child refuses the potty? Well, we recommend respecting those wishes and not forcing them. Like I said, this is how potty battles begin, and toileting can become stressful for you, for the child, and we really want this to be a positive experience for both of you. So it's important that your child feels that they can make decisions throughout the process. So instead, you might say, "Oh, you don't need to go pee. We can try later." A little pro tip, we do recommend avoiding questions. So instead of saying, "Do you need to use the potty?" You could try saying, "You look like you need to pee," or "I'm going to try the potty." Oftentimes when we ask our children if they need to use the toilet, they're going to say no. But if we frame that in a different way, they might be more open to listening to their own body cues or following our lead. So we've done step 1, on the lookout, step 2, helping them to the potty. Step 3 is acknowledging their effort. So some children respond in different ways to acknowledgement. For children who respond well to it, we can provide them with excitement. So we might say, "Wow, you put the pee in the potty." For children who don't like that, who maybe tend to kind of avoid, being the center of attention or don't like that sort of response, we might say instead, "Oh, you put pee in the potty." We still want to acknowledge their effort, but we don't want to make them feel embarrassed. If your child didn't make it and had an accident, you could say, "Oops, we missed the potty. We'll try to get it next time." So for step 4, we recommend strongly to play it cool. And, that means that we are trying our best to stay calm when our child does have an accident on the floor, because I promise you it will probably happen. It shows the child that accidents aren't scary and it's not something to be embarrassed by, and that it's okay that there's mistakes made while we're learning. We recommend calmly cleaning up the mess. You may want to see if your child wants to help, so that they can, for example, if they have a bowel movement on the floor, they could help you put it into the toilet to show where it's supposed to go. But we definitely recommend not forcing them to help clean up if that is something they don't want to be involved in. So when I'm working with caregivers on toilet training, it's not uncommon for me to get the question of, well, what about a schedule? What about, a timed routine? Some potty training programs encourage parents to have their child sit on the potty at regular times, which typically starts with a lower number, like 20 to 30 minutes, and then extending this time if your child can hold their bowel movements longer. But what we find sometimes with that is that it can create more upset or more stress, because you're trying to get your kid on that timed, you have that expectation of they need to be on the toilet every 30 minutes, and the child is refusing that, and then there's lots of potty battles. So if you find that that time schedule is something that creates more stress for your relationship with your child, then don't do it. We've given you other ways that you can guide them to the toilet, or notice their signals and make those comments and guide them instead of direct them. Some kids might require this toileting schedule depending on their needs and what they tend to prefer and their preferences. But if it doesn't work for you, that's okay too. So if you would like to use a toileting schedule, like I said, that's fine if that works for your family. But it's important to avoid creating too many demands or rigid expectations, especially if your child is showing that they can hold their bowel and bladder longer. Because if you ask them every 20 minutes and they don't have to go, they're probably not going to want to leave what they're doing and then go to the toilet. What we really recommend is following your child's cues, like I've already mentioned. So supporting their interoception and their autonomy in making that decision for themselves, so they can have true learning of what's going on inside their body, and connect that to going to the bathroom. That said, toileting at natural transition times throughout the day can be very helpful, and we do recommend doing this. So for example, offering the toilet when your child wakes up, especially if you're working on something like nighttime training. Other good times include after meals, or before leaving the house, or before bedtime or naps. So using these natural moments respects your child's rhythm and creates gentle opportunities to practice that toileting without pressure or conflict when they're already transitioning to another activity. So we've completed phase 1, which is the toileting foundations phase, that 3 to 5 days of active training. Now we're moving on to phase 2, which is the generalizing phase. And this is when your child's starting to understand that their bowel and bladder movements go into the toilet. And this is usually 1 week after that focused training. You'll likely see fewer accidents and more success with their bowel and bladder movements. But it's not uncommon to see that the bowel movements tend to take a bit longer for training, which we've discussed. You'll continue to use the same strategies in this phase that you used in the training phase, but you might find yourself watching less closely as your child begins to recognize those cues a bit stronger, and they take more initiative as a result. This is a good time to start introducing loose-fitting pants, gradually introducing underwear, and making it easier for your child to manage their clothing independently. This phase is about practicing and building confidence with patience and encouragement as your child becomes more independent. So as your child moves through this phase, you can begin introducing outings in safe and familiar places or locations that have easy access to a toilet. So if public toilets feel overwhelming, bringing the potty along with you might feel helpful and more secure for your child. We recommend continuing with regular toileting routines, so when they wake up, before you leave the house, etc. You might notice longer stretches between bathroom trips, which shows that growing body awareness. We recommend offering fluids as usual, so don't load them with fluids like you may have in the first phase. Offer them fluids as you normally would. And remember, the most important thing to remember is that accidents are still super, super normal at this stage. So we recommend bringing along extra changes of clothes anywhere you go. Patience and reassurance will support your child as they practice in these new settings. In general, the overall goal of this generalizing phase is for your child to more consistently recognize their cues and begin initiating toileting. You'll see more success than in that initial training phase, though, like I said, accidents are pretty normal. The phase focuses on building that confidence and independence as your child starts to toilet and trust themselves and their own confidence in toileting. So now we are in phase 3, which is that maintenance phase. So what we recommend in this phase is to continue with the routines you've already established, because that consistency will help your child continue to feel more secure and build their independence. You can begin expanding your outings, but it's important to keep in mind sensory environments in new settings. So, noise, lighting, automatic flush toilets can be pretty freaky for some kids. So we recommend being mindful of that. Always bring extra clothes because accidents are still very normal in this phase. If your child's physically able, you can also start encouraging participation in wiping in this phase, starting to build more of those independent skills. It's not uncommon to see regressions during this phase, but this doesn't mean that progress has stopped. This phase is just really about strengthening skills and being patient and providing ongoing support. The overall goal for the maintenance phase is for your child to feel more confident and more natural in their routine of using the potty. You may notice that your child may begin to seek out the potty more independently and might not need as many reminders or support from you. You'll also likely see more potty successes in this stage rather than accidents. And it's really about reinforcing your child's independence and helping them feel secure in their toileting skills. So now that we've talked all about the foundations of toileting, prep phase, and training phase, we're going to talk a bit more about training specifics. So these are some of those more advanced skills that you might see later on in the process or that you may have questions about. So oftentimes I get questions around nighttime or nap time training and if a child should be wearing underwear to bed or a diaper, whatever. It's developmentally expected that your child is going to daytime train before they could nighttime train, and we'll talk a bit more about that. But if you're worried that your child will revert back to using a diaper because they wear a diaper at nighttime or during nap, we recommend trying to find a different style than they're used to or brand, and if possible, refer to these as your child's sleep undies rather than their diaper or pull-up. It just gives the child a different name for them and helps keep them moving forward with using underwear. We do recommend toilet training daytime first and then targeting nighttime and naptime training later. Doing both at the same time can feel overwhelming and exhausting. If you notice your child is consistently waking up dry from their nighttime sleep or naps, then maybe they're ready for that step because that might indicate to you that they can hold their bladder and bowel for longer periods and that they're ready for that nighttime training. Most of the time we don't see children staying dry overnight or during their nap until they've had lots of daytime success. Daytime training really helps that bladder and bowel, the muscles of the bowel and bladder to hold for longer periods of time. It can be up to a year after daytime training before a child is ready for nighttime and naptime training. Nap time may happen sooner because children are asleep for shorter periods, but we actually don't even see that full control developmentally, usually until between the ages of 5 to 7. So if you're noticing accidents in the middle of the night or they require a diaper pull-up for a while after you've daytime trained, that is completely normal. It's also important to consider if your child takes any medications that might impact their bowel or bladder and how this might impact their ability to feel for body cues while they're asleep. So you might have trained on using a potty or a portable potty, and you might be ready to start to transition to the big toilet. And so I often get questions around how to do that, especially for children who might have difficulty with change. Some children might transition easily, whereas other children, it might take longer. Each child moves at their own pace, and that's okay. But the whole focus when we're making this transition is to continue to focus on exposure, but making the bigger toilet feel safe, just like we've done from the start. We want to make this process feel comfortable and safe for your child. So here's some tips and things we recommend when transitioning to the big toilet. The first being, don't force or coerce your child to get on the big toilet, just like we've been talking about with toilet training from the start. We suggest allow your child to watch you on the big toilet. So when we talked in the prep phase about, your kid following you to the bathroom or allowing that modeling to take place, can be really helpful for them to observe and then understand that it's safe for them to be on the big toilet after watching mommy or daddy do it. Place their potty near the big toilet so they're continuing to see it and notice it. Use books or videos that show children sitting on big toilets, and allow your child to do some fun things. Maybe it's flush the toilet or watch the water go down, etc. So another really important tip to consider when thinking about transitioning to a big toilet is a child's positioning. So big toilets are not built for children. It's shocking what I see sometimes in public spaces. You know, these giant toilets, and little peanuts are having to climb up and feel secure on them. And so it's not uncommon to see children feeling nervous or unstable on the toilet due to its big size. So we recommend ensuring your child feels safe and well supported by providing, you know, maybe a ring reducer, step stool, handles. All those things can be really helpful. And you could even get ones that fold up and are more transportable. So you could have one with you for when you go in the community or if you're in a family member's house, etc. Having the body feel well positioned and safe on the toilet really helps the body feel safer. And what about wiping? I do get a lot of questions about wiping as well, and this is definitely a completely different skill, a more advanced skill, and not something we would expect a child be able to do right away. So, you know, you want to think about this later on in the process when they've got more of that learning down pat about how to actually use the toilet. So don't stress out by teaching the wiping right away. Of course, if your child shows interest, you can engage them in that activity and teach them, but do not force or coerce when teaching wiping. Wiping is a more advanced skill than I think we give it credit for. It requires fine motor control, core strength, motor coordination. It's multi-step. There's sensory components associated with wiping. So, like I said, we wouldn't expect your child to know how to do this right away, and it might take a long time to teach them, which is totally fine. But what we recommend overall is returning to that goal of decreasing stress around these skills and increasing autonomy. So offering, modeling, commenting, letting them watch you, and hopefully over time they're going to be more open to trying out wiping themselves. So that is it for the majority of the content from this presentation. What I like to leave families with are these mantras. You know, toileting and toilet training can be stressful. Maybe it's been something you've tried multiple times, or you know, you tried and it didn't go well and you don't know how to restart, or you just don't know where to start. And so it's very natural to feel stress and some frustration around this process. But what we really want you to remember is that you are good parents. You know your children best, and this is all a learning process. Your child's potty learning is happening exactly when you're all ready. The mess is temporary, and your child's pee or poo will not be on the floor forever. This is your child's body, not yours. So this is a learning process for their body and their mind, and you're there to support them through that. This might be a hard moment in parenting, and it's okay to feel overwhelmed, and it won't last forever. And your child is learning. They're not giving you a hard time on purpose. They might just be having a hard time. So we have this again in a handout, and if you found this helpful or inspiring or motivating or whatever it might be, you can print it out. You could leave it on your fridge. You could leave it in the bathroom. It's just things to remind yourself of throughout this process. So just some final thoughts before we wrap up today. This is a process and a learning journey. Every child goes at their own pace, and we encourage you to reflect on what success looks like for your child instead of comparing maybe to a milestone or to another child. We hope that you feel confident in your own skills as a parent to support your child, and we hope that this empowers you to feel ready to try toilet training. We advise that you consult the toilet training mantras if you're feeling stuck or really stressed about where your child is in the toileting process, and we hope that gives you some encouragement along the way. Thank you so much for joining, and we hope that you enjoyed this presentation. We want to leave you with just a small statement in reminding you that you're a good parent, you know your child best, and this is a learning process for everybody. Thank you.